We're going to do another review for the Journal of Pediatric Surgery. Today we're going to talk about the idea of laparoscopic versus open Kasai. There have been previous reports that have said that the laparoscopic Kasai is not as good as the open Kasai, that the jaundice clearance rate is not as good, and there have actually been people that have suggested putting a moratorium on the laparoscopic Kasai until we figure out better data. And so now it's being challenged by Professor Long Lee in this article that was in the Journal of Pediatric Surgery, a prospective study comparing laparoscopic and conventional Kasai portoenterostomy in children with biliary atresia. This first author was Su Sun, the senior author was Long Lee out of Beijing, China. And it was a prospective study comparing laparoscopic and conventional Kasai portoenterostomy in children with biliary atresia. And they compared prospectively two groups. 95 patients had biliary atresia. The two groups were the laparoscopic Kasai and open. There were 48 patients in the laparoscopic group and 47 patients in the open group. There were 4 patients in the laparoscopic group that were converted over to open procedure because of bleeding. And here's what they found. Operative time was slightly longer in the laparoscopic group than the open group. EBL was slightly lower in the laparoscopic group compared to the open group. Time to full feeds, patients with laparoscopic Kasai fed sooner than those with the open Kasai. But the real core to the study was there a difference in jaundice clearance? And they found no. There was no difference in jaundice clearance that was statistically significant. It was 43% clearance in the lap group versus 51% clearance in the open group, and that was not statistically significant. The other liver function tests also were the same between the two groups at 1, 3, and 6 months. No difference in cholangitis, no difference in the native liver survival. The length of stay was the same, and there was 1 wound infection in the open group and nothing in the lap. So essentially the same. So we hope you enjoyed this review. Please leave comments below and let us know what topics you'd like us to review in the future. Thanks.